Thank you, Nadine. Could you see my presentation? Okay, thank you. I was in the mission, the two missions, one in Ethiopia and another in Angola. The mission in Ethiopia was from 18 to 25, 24. And the mission was to share experience of that's what is happening in Ethiopia, because as you know, we are implementing a project funded by NORAD project in Ethiopia and in Ghana, and Ethiopia is having a very good experience. That's why we find that it is important to share this experience with other countries, specifically Ghana and Uganda and Zimbabwe. The general objective of this mission was to share and learn good practice of NORA project implementing in Ethiopia and to generate change in Zimbabwe and Uganda. These are specific objectives. I don't have time to talk about that. And these are the countries. Each country, Uganda and Zimbabwe, participate with three colleagues. These are the team from WHO, Angola, WHO, myself, António Armando, and my colleague of communication. We arrived at Ethiopia on 18, and this was agenda and the activity that we developed. The first day we have opening remark and presentation of the objective of the mission, and we have a presentation of NORA project in Ethiopia. 2021, we visited these facilities where NORA project is getting implemented. We visited 3 facilities and 1 school. And in 22, we have a meeting with staff of Ministry of Health. They explain what they are doing in NCDs. And 23, we have a meeting with WR, and we was working in planning to include these good practices in the program of Uganda and Zimbabwe. What are the lessons that we learn in Ethiopia? We divide this lesson in 6 blocks of health system. The first one is about leadership and governance. We learned that in Ethiopia there is a strong political commitment on NCD by the government, and the government have the ownership of the NCD program. And the health system is getting strengthened by this NORA project because the country feel that things now are going well, and they are working, as my colleague Sharon said, in sustainability, because this program it will be implemented for 4 years, and after the end of this project, they want to continue to implement this project by their own money. And health service delivery, what we learned that there is a decentralization of NCDs in primary health care. What they are doing, they are trained nurses, they are trained pharmacists, and nurses are treating NCDs. And about health information, they have a system that collects data. They collect data manually, but after that, they send data to the center where they process this data. And every month they have the data. They know, for example, how many patients were screened, how many patients with no communicable disease, specifically diabetes, hypertension, and cervical cancer. And in financing, what we learn is the country has a community-based health insurance, and the majority of the population are covered, and they pay only $20 per year, and with this money they have access of consultation, medicines, and tests for no communicable disease. And in the health services, especially in primary health care, they have all of the technology needed to screen, to treat. For example, they have material and technology to treat pre-lesion cancer for cervical cancer. and they have availability of medicine in the facility. And if the medicine are not there, they have pharmacy where the people can go and take the medicine if they have insurance, as I said. And about the human resource, they have adequate human resource in place, medical doctors, nurses, and pharmacists. And one of the most important things that we learn, they have pharmacy, because this professional, he is responsible for the management of all of the medicine. He knows what kind of medicine they need. And one of the most important we learn about the medicine, they reduce the quantity of medicine, because nurses, they don't need to have capacity of knowing all of the medicine of diabetes and health and hypertension. With this reduced number of medicines, allow them to prescribe this medicine with secure. In conclusion, we learned that Ethiopia has made a tremendous stride in decentralizing NCD services, integrating them in primary health care, that is improving the access of those in need, and the strengthening of capacity building of data quality is crucial for ensuring accuracy and reliable data that can support decision making and policy formulation. And as a recommendation, we recommend to establish a network for focal point across country to learn about this very, very, very good experience of Ethiopia. And about Angola, I would like to say that I don't know how many minutes I have, Nadim. Yes, Angola, I would like to say that Afro is supporting Angola financially and technically, and we was supporting Angola by online, but they requested WHO Afro to support them in person, and they invite me to go there, and I spend 2 weeks to finalize the multi-sectoral strategic plan. Is the first strategic plan from non-communicable disease in Angola. What I learned in my presence in Angola is that in some country like Angola, they need the support of WHO, because in Angola, I didn't find the commitment of the Minister of Health as I found in Ethiopia. I think that in this case, WHO must be there, because we know the document, we know all of the guideline documents of NCDs, and we support them, and they are very happy because of this support. Thank you.